I'd like to welcome everybody here today for this webinar. I'd like to welcome you to the 2017 National Healthy Homes Month webinar series. National Healthy Homes Month offers an opportunity to learn more about housing and its impact on health and provide resources to encourage local activities as well as empower families to protect themselves from hazards in their home. This June's outreach activities aim to greatly boost awareness and understanding of what federal and local resources are available to make a difference in the lives of all residents, regardless of where they live. For more information about National Healthy Homes Month, including resources for your program, you can visit www.hud.gov/healthyhomes. Today's webinar is Creating Healthier Indoor Environments for Child Care Facilities, presented by Pamela Turner and Diane Bales from the University of Georgia. We are pleased that you have joined us for this event. This webinar series is sponsored by the HUD Office of Lead Hazard Control in Healthy Homes, USDA National Institute of Food and Agriculture, and the National Healthy Homes Partnership. This webinar will last approximately 1 hour with 15 minutes at the end for questions. At the end of the webinar, you will be given information on links to additional resources for your program. We will be recording this webinar and posting it for you for your viewing later if you prefer. Finally, we ask that you mute your microphone during the presentation. You may unmute your microphone for questions at the end. If you have questions before then, please feel free to post them in the chat window. So let me go ahead and turn it over to Pam Turner. So Pam, we look forward to this webinar.
Thank you, Michael, and we're excited to be here. This is, as Michael said, the presenters today will be myself and my colleague Diane Bales. So this has been a great cooperative project that we've worked with as well with Rebecca at Missouri, who has been doing child care provider trainings for many, many years. So what we're doing is pooling together our knowledge and resources in order to share them with you. We encourage you to ask questions in the chat box if you have any along the way. And then, of course, there will be time, as Michael mentioned, at the end for questions. So what we're going to cover today is basically our objectives are helping understand why children are vulnerable or more vulnerable than adults to the hazards in an environment, and in this case not the home but in the child care learning facility. And then what are some of those hazards that you might find in one of those settings, and then what steps can actually be taken to reduce environmental hazards, and then probably, as if many of you are educators, you're more interested in resources and strategies and how can you actually reach this audience of child care providers. So Diane's going to start us off, or Dr. Bales.
It's good to be here with you all. I spend more of my time educating people in the early childhood field, so this is a great opportunity to connect. And I want to start out just by making it clear why this topic is so important in the child care arena, and that's largely because children are not miniature adults. And so how children are affected by environmental hazards is very different and sometimes more dangerous than the ways that those same hazards affect adults. And so on the next slide, we're going to talk a little bit more about some specific reasons why children are more vulnerable. So we all know children are smaller. They are at a particular stages of development where their behavior is less mature, and their understanding of hazards and dangers is less mature. And so these three things combined put them at greater risk when they are exposed to environmental hazards. Some of the things we know children do naturally. They are biologically programmed to be explorers. So they spend their time touching and crawling and walking and picking things up, placing things in their mouths, which is one of the most common ways that infants and toddlers especially explore the world around them. And so they're more likely to be on the ground, they're more likely to be on the floor. They spend a substantial amount of time indoors where contaminant levels tend to be high, but they also spend a lot of time outdoors. And so they're at a higher risk of ingesting dirt, ingesting dust, placing their mouths on other objects that may be contaminated, as well as being at risk of exploring things that are hazardous, such as cleaning chemicals. We also know that childcare is an important audience and an important context for education about environmental hazards because substantial numbers of children spend a lot of time in childcare. So in the U.S., about over 20 million children under 5 are in some type of child care. About 90% of preschool-age children, that's roughly 3 to 5-year-olds, whose mothers are employed, spend on average 36 hours a week in child care. And even children whose mothers are not employed spend something like 21 hours a week per week in child care and early education settings. And so children spend a lot of time in these places. And we know that there are substantial potential costs for unhealthy environments. This slide gives the costs attributable to various different childhood diseases, with accidents in the home and lead poisoning topping the list as the potentially most costly, but also asthma and missed school days for asthma accounting for another total of $12 billion of annual cost. And these are much higher than the annual cost for childhood cancer. We're also concerned about neurobehavioral disorders, some of which may be caused by being exposed to unhealthy environments. Now, the challenge that we have in working with child care is that child care training and regulations vary by state. So depending on the state where you are working and where you are trying to help people understand and reduce the risk of unhealthy environments, the child care licensing regulations change state by state. And so the standards are complex and the standards vary somewhat. Now, all states are concerned with the basic ways of keeping children healthy, but how states actually implement requirements look different state to state. So what works for us in Georgia, what has worked in Missouri, may require some variations and some modifications to work in your state if you're not in one of these states. All early care teachers, child care staff are required to receive some annual training, but the amount and the specific requirements, again, are different state to state. We do know that there's a great need for more training on healthy indoor environments. Many states do not have this as a specific requirement, and many early childhood staff and child care staff are not getting this kind of training. And so the kinds of information that can be shared on healthy environments can be a real benefit to help keep children healthy.
So we can take those principles of a healthy environment that we talk about in terms of a healthy home and apply them to the healthy environment of a child care facility or center, and sometimes those child care facilities are actually in people's homes. So it could be that it's in a home, but we want to be sure that we delineate or that we distinguish between a home where you live and a place where you're actually taking care of children. They are different. The principles, though, can be applied across the board. The pest-free is pretty obvious, keeping pests out. Maintenance is an issue in a home and a child care facility. Ventilation, and I'm going to give you some examples as we go through. Dry has to do with mold, and when you live in the South like we do, mold is a huge issue, but it's also an issue in many parts of the country that aren't deep down in the South, but even in the North, wherever the humidity is high, you have mold issues, or when there's flooding or heavy rains. Contaminant-free is pretty broad. That includes a lot of different types of contaminants. It could be radon, it could be lead, it could be carbon monoxide. There are many, many things that could be contaminants inside a facility. Safe is obvious, keeping things out of reach, keeping things stored properly, keeping tripping, falling hazards away. Temperature controlled is an issue related to that. That one is the one that's different for most areas. It means keeping it comfortable in there so that you don't have issues where it's too hot or too cold, but you're also at the same time saving money, so it's also efficient. So that's a broader one, but it still is a very important one. Keeping it clean is pretty obvious. Cleaning is something that there are standards and rules that you have to follow, but the less chemicals you can use, the better, but yet you still want to follow the guidelines of that state. And whoops, up there it went. Okay, I'm still learning some of these things. When you have two screens, you're never sure what's going on. So healthy environments is really much of a holistic approach. So we talk about the structure, and that structure could be a home, it could be a brand new built building, it could be an old building. So like lead is not an issue in a brand new building usually, not in the paint at least, but it might be in an older building. So the structure makes a huge difference. Maintenance is going to be maybe a bigger issue in that older building. Health hazards vary according to the structure and according to the population of people you have in there. Is it a large one, small, different health hazards, what the people bring in with themselves or in with them. People is a big issue in bringing pests into facilities. You might have lice issues, you might have bed bugs is a big one now. So there's different issues there, but the three kind of interact together, and healthy environments takes into account all three of those areas. And we know that when you're exposed to something, if you look at that bottom on exposure, there's lots of different kinds of exposure. It could be lead, could be pesticides because you've got pests and you're spraying a lot of chemicals. And so many of us think that if a little is good, more is better, which is not true. Mold is an issue in many parts, and that could be from a leak even. It could be just humidity, but it also could be just leaks from poor maintenance. Radon is an issue in many parts of the country and something that many child care facilities do not check for. Asbestos, with a lot of our old building products, we had asbestos issues, and mercury in the a lot of that comes from the thermometers. So a child could be exposed to a lot of different kinds of things. The outcomes of that, if you take the one of mold, exposure to mold and exposure to pests can lead to asthma. Exposure to lead and ingestion of lead can lead to developmental disorders. And exposure to high levels of different asbestos or radon or a lot of different chemicals could lead to any kind of childhood cancer. Those outcomes then have impacts in terms of the actual well-being of the child at a younger age, where like asthma leads to absenteeism, poor school performance, more time in the hospital, more expensive hospital care. And over a long time, lead is one they've done a lot of research on that shows that exposure to high levels of lead at a young age can actually impact your lifetime earnings and your outcomes over your life. So our environment has a huge impact on us, and it's important that we keep that, especially for our young children who are more vulnerable, we keep it safe. So what I'm going to talk about is just a few little quick action steps, because with this presentation, at first I had put it together talking about the actual issues that you would talk to in a healthy child care environment program. But what I've done instead is just give you a couple of examples, and then we'll talk more about resources, because my guess is that resources are going to be a little bit more important, and then as we have time, we'll kind of work through. So I'll elaborate on a few of these. So if you're actually doing a program on healthy child care environment, you could talk about one issue or you could talk about several. So this is an action steps for each of the issues. So if you talk about a pest-free, most obvious one to keep pests out is to store food, because pests like food and water. So if you keep the food and water away, then you're going to reduce the number of pests that you have. If you keep it maintained and reduce your water leaks, you're going to also reduce mold hazards. If you use a bathroom fan, you're going to keep it well ventilated. The other big one with ventilation is not parking cars next to the intake valve and not letting cars idle next to the intake valve, so you're not bringing in contaminated air into your environment. Indoor humidity below 50% keeps it dry. Testing for radon is one way to keep it contaminant-free. Installing a carbon monoxide detector, smoke alarm, a lot of different things like that can help. With smoke alarm, not so much for contaminants, but that's a safety issue, sorry. Contaminant-free would be more the carbon monoxide detector or the testing it for radon. And storing cleaning products in locked cabinets can keep it safe. And then set the thermostat at a comfortable level, keeps your temperature controlled. Sorry, I had an interruption. I forgot to post a note on my door. Cleaning often, and that goes without saying. Cleaning with fewest chemicals as possible, but yet enough to meet the standards to make sure that you are using the sanitation and following the guidelines, but you're also cleaning it often. And getting rid of clutter reduces tripping hazards. Cleaning also reduces food for pests and things like that. So there's lots of different steps you can take to keep your environment healthy. So if you were doing a program on asthma triggers, that's a big one for a lot of people. You actually can touch all 8 principles in one program on asthma triggers, because getting rid of cockroaches and rodents, they're pests and they also trigger asthma. Dust mites is another trigger for asthma. A lot of that's about cleaning and keeping the humidity level low, which will also control the mold and moisture. Most people have no smoking in their facility, so you don't usually have an issue with tobacco smoke, but you could still. Pets, if you have a pet in the child care center, then most of the time it's not a cat or a dog, but if it was, you'd need to be careful with that because of allergies and dander. But it could be a hamster or something like that that might cause problems. Chemical irritants, those are the cleaners and the pesticides, because when we see pests, we use pesticides. When we clean, we sometimes use a few too many cleaners. So you actually could do a program on asthma triggers, hit all 8 principles, and talk about what you would have people do. And the most important thing that you can have people do is to create some type of an asthma action plan for each individual child who has asthma or severe allergies. So this is an example of one type that one of our extension agents use, but you could use a lot of different things. It's finding something that works and making sure that everyone in the child care center knows this child had asthma, these are the issues, these are the triggers. It could be food as well. It's not just environment. We're just talking about environment today, but you could mesh the two together and talk about it in a training and working with the food specialist in the state. So a lot of it's knowing what's going on with that child, knowing what's a danger for that child, and then also making sure that parents know what to do so that they know what you're doing at the center and they also know what they can do at home. So environmental triggers, if you think of it, you may not have carpeting at your child care center, but at home the child may be exposed to carpeting that has a lot of different contaminants in it. And not that all carpet's evil, it's just that you may have heavier levels of dirt and dander from the animals. You don't clean as often. A HEPA vacuum is a wonderful investment if your child has asthma to reduce the number of triggers and things that child is exposed to. Dust mites is a really common exposure. So if you can reduce the child's exposure at home as well as at the child care center, then you're well on your way to winning your battle against asthma. So if you have this, they're just the one example of a program. So I'm going to talk a little bit about what we've done and what Missouri's done. So Rebecca couldn't be with us today, but she has been teaching classes on healthy environments. It may have been called other things when she started. She's done a lot of different programs over the years in Missouri. Class size vary. There are CEUs, I think is what she called them. They may be called different things in different states. Basically, they're educational requirements for that state, and they do vary state by state tremendously. So we're talking about just that extra education that they need each year, and usually it's something, and hers classes she teaches are for 2 hours. So when you get into the area of teaching the classes, it's a good partnership to build with a human development specialist like Diane is. So they've generated money because they actually charge for them, and I'm not positive, Diane will know more if we charge here in Georgia, but when you charge, the person is paying because they're required to get the class. They're also learning something new along the way. So she's done a lot of, go ahead.
Sorry, the short answer about charging in Georgia is yes, most of our county programs charge as well. Usually it's a very minimal fee because a lot of child care providers aren't able to pay a large fee, but we've learned that charging a little bit increases the likelihood that they're actually going to attend as opposed to registering for a free program.
Yeah, and we're kind of changing, and those of you in Extension know that we have this idea that you shouldn't charge for anything, but you really should, because as Diane said, it gets people to come out and there's more value placed on it if there's at least a small fee associated with it. Doesn't mean you're charging $200, you're just charging a little bit. They've done a lot of different things. She's done a lot on heating and cooling. She's had good response from people on the two things that she said she gets the best response from are radon programs and emergency response planning. And Diane and I just did some training of the agents on emergency response, and that's a big area for disaster planning and different situations that could occur, and there's a lot of emergencies is a pretty broad concept. She also does some stuff on toy safety. So there's lots of topics you could do that relate to healthy environments. They have marketed theirs to child care facilities, agencies, to schools. She did a lot of the radon with Head Start centers, promoting it, promoting the radon testing. Basically what they would do is link the child care facilities to the state so they could get a free test kit. And in every state, the radon program is going to change as to whether that kit is free or whether there's a fee associated with the kit. For example, in the state of Georgia, because of exactly what we're talking about, value, we actually charge a small fee for radon test kits because it increases the likelihood that people will use them rather than when they get something free, they put it in a bag and they never open it again. So we found our testing rates increase from 30 or 40% up to 60 to 70% just by a small fee for that. And we're talking like $10 to $13, not a lot. So they've done a lot in promoting radon testing in their state. We've done some here, not nearly as much. And every state is a little bit different. But many times the child care centers can get free test kits from the state indoor radon grant providers. And that varies whether it's the health department or it's Extension or it's another agency. So that's something you can find out by just looking at the EPA radon site. And they've also developed checklists, handouts, displays, and this cute bingo game I'm going to link to. So they have this bingo that we use the word child care, by the way, rather than daycare. And Diane can tell you why in just a minute when I explain this game to you. What they use this bingo for, this is a little bit different than normal bingo, but you could play it however you wanted to. Basically, they give people this paper and have you go around the room of all the participants in the training and you find someone who doesn't leave wet towels and clothes lying around or uses a damp mop to clean, and then they check that box. So then they get bingo from finding somebody who does all those things. So it's a little bit different way to play it. And Diane, you can tell us why we use child care rather than daycare.
Child care is a more accepted term, and actually early care and education, or ECE, is even starting to be more accepted. Because it's more professional, it makes it clearer what's happening in these programs. Daycare is a very old term that is not used as much in the professional field. So if you want credibility with child care programs, call them child care, not daycare.
And that's a good piece of advice. That's why you partner with your colleagues at the universities and out in the field so that you may know a lot, like I know a lot about healthy environments, but I don't know a lot about children. So Diane has the children knowledge and we can mix it together and you end up with something that's a little bit stronger. So, but this is a fun game that they do. Georgia, on the other hand, we haven't been doing healthy environment trainings. We've done child care trainings for years, but not on healthy environments. So we have one agent in particular who does a lot, but others do them as well. So we've done face-to-face trainings, and then we've been doing webinars, and we did that in partnership with North Carolina State University Extension. So we did a webinar to reach out to people on general healthy environments. We did two, part 1 and part 2, and focused in on specific topics in each one. But it still was just kind of skimming the surface. You really could do a whole webinar on radon or a whole webinar on asthma, and we just hit on healthy indoor air in general and covered the principles. And that continuing education, which I kind of used the wrong word, it's educational credits, whatever your state calls them, but it's basically those extended knowledge credits. We did offer that for the one in Georgia, and I think North Carolina would also accept them. So you can actually do a webinar that crosses the state lines, but also provides credit for people. Programs and resources that we've done here, like a lot of programs and like Missouri does, you kind of pick and pull pieces of resources and information together to create your program. So it isn't like there's this wonderful package, although there is one I'll talk about in a minute. Most of us pull pieces together to create those programs. So here in Georgia, we've used one that was adapted from I believe it was from a Houston program, and it was for asthma called Breathe Easy. Then one of our agents created another one called Poison Prevention, or the 3P, Poison Prevention Patrol, and then just a general healthy environment. So they vary quite a bit, and it depends a lot on, like I said, there is a lot of leeway to create your own. With ours, we don't do bingo. She created something called Lungo because it was asthma focused, and it can be played a couple different ways, but essentially it's played more like a traditional bingo game. And then she did some word scramble things because people still like to do that kind of stuff, and at least you're engaging people. And when she does, so in a minute I'll cover the other one. So she does interactive things, which Missouri does as well. You have activities and events things that engage people in the conversation, so you're not like we are today just talking at you. You're actually engaging them in the conversation. So what issues have they come up with, and let them think about the words. You always do the asthma, almost everyone does the straw test with asthma, where you have people stick a straw in their mouth and breathe through it and plug their nose while they're breathing for a minute, unless they have asthma. And it gives you an idea of what it's like to breathe through. The straw is like somebody having an asthma attack. That straw doesn't, and it's a cocktail straw, so it's a very narrow straw, doesn't allow a lot of water to come, or air to come through. If it had water, you'd be up a creek, but it doesn't allow air to come through. So you end up gasping for air, which is what an asthma attack, so you're kind of mimicking it and helping people to understand. And with, like lead, to get people to understand how little lead it takes to contaminate an area, you can use an example of like a Sweet and Low or Equal package, that 1 gram package. That tiny, tiny amount of sweetener can actually contaminate about, I believe it's 8 to 10 houses from a tiny amount. So you can tell that lead is dangerous. So you get people engaged, you get their attention with different things that are going on, and that then gets them more of a buy-in, the asthma things. And actually we've had success, and Missouri's had success in getting people to, they learn more, but they also go back and they do something and make changes in their child care centers. So the other thing with the poisons, and I'm going to let Diane talk more about this, but with the poisons we talk about bleach a lot.
And bleach is an issue in child care because a few years ago, the bleach manufacturers changed their formulations. So we used to have a standard formula of how much bleach to how much water for sanitizing and for disinfecting in child care. Now that bleach manufacturers have changed their formulations, it's much more complicated because you have to read the specifics that are on the bleach bottle in order to know, and then go to some websites, EPA website, to get some information on exactly how you dilute it to be appropriate and to be safe for child care. So this is a publication we have used in conjunction with this programming to help child care teachers and cleaning staff in child care programs understand how to dilute bleach appropriately for sanitizing and for disinfecting in child care.
And as we move to talking more and more about green cleaning, that's a really fine line you want to walk, because bleach is not an evil. Bleach is a necessity in childcare. It's a necessity in many things. So you need to be really careful when you are talking about reducing chemicals and green cleaning. You want to be sure you're not saying getting rid of all bleach, because that is not appropriate. And when our agent does this program, she talks about all kinds of poisons. So she has, we were just talking about this morning, lookalikes, and we worked on a publication with the University of Maryland Extension on lookalike products. And that's a good way to also talk about what products look like other products. So does, you know, the old X-Lax looks like a chocolate bar. Sweet tarts look like some medicines for children. So there's lots of things, you know, the blue Windex looks like blue Gatorade. So she has taken that, and with the pills and medicines, she actually puts them into a baby bottle and mixes them up. So you may have gummy vitamins that look like little bears mixed in with Haribo bears. And can you tell the difference? And she puts them in a baby bottle for the effect of, look, this is a bottle that your child could have, and of course you're not drinking it. But there's lots of the old Sudafed and Red Hot, so there's lots of different things that they've done. She also has implemented, and I like this idea a lot, getting people to read the backs of bottles. So reading that label, one of the things you can do is take that bleach bottle, talk about the whole idea that Diane just mentioned of the changing in concentration, get them to figure out what concentration would they need to use and read the label on the back of the bottle. Whatever the product is, people do not read household cleaner labels. I mean, when was the last time you read the label on how to use Windex and the safety, if there are any safety things on there? Do you even know what's in there? And products like household cleaners don't have any kinds of requirements for disclosing to you what's in the product. So you need to look it up. And I don't have this in here, but you can use my favorite website, which is the National Institutes of Health Household Products Database. That's a great website to find out what's in a product. So if you want to know what is it that's in Windex, or what is in Fabulosa, or what is in any kind of cleaner, you can type that and you can see what's in there if it's in the database, and the database is pretty big. And then you can see what other products are similar to that one that contain the same ingredient, and you can even link into a toxic, I think it's called the Toxic Industry or Registry, and see how toxic the products are. So that's a great website. That's the Household Products Database. Oh, somebody just asked, and it's called Household Products Database. And while you're asking questions, I'll type it in if I can think of it. Because I'm not very good at doing 2 or 3 things at the same time. But it's the National Institute of Health. And it is well worth knowing that website. So other resources, we always want to talk about the Healthy Homes Partnership Toolkit, which was really developed for healthy homes. So you want to always be careful, and as Diane said, to maintain credibility, you do not want to be talking about healthy homes when you're doing a child care training, because it's not a home, it's a child care center, training facility, whatever you want to call it. Whatever is used most like in your state, that could vary. You can take, though, the material in there is very similar. You just want to adapt it. So you could go in and say, let's talk about carbon monoxide. Use that program, that lesson plan, that this is what you need to take with you, and adapt it to that child care environment. And that would be a great thing to do, because those are already there and they're easily available. Readily available, and they're free. The other source for resource is the EPA. The EPA has some great things on their website for healthy childcare. They have things for parents, things for providers, they have training, they have curriculum, and again, you may be wanting to adapt it to fit the needs of your state. Always important to know what are your state requirements, because that varies state by state. You always want to know that more than anything. And then you can take the resources and adapt them for use. There is one curriculum that is more eco-healthy, and this is a certification program. I think it's called, I don't know if it's certification or what it's called, but eco-friendly or eco-healthy childcare has an actual program, and so child care centers or facilities can actually sign up and become, I think they pay a fee because this is a nonprofit organization, and you can become a eco-healthy child care provider. So it's a good training they do. Their check sheet is very good. It is missing a couple things. I think it's missing, I can't remember, I want to say carbon monoxide is not mentioned, but it is a very helpful checklist. And it depends on your state, but before you just start providing this type of training in your state, you want to be sure that your state agrees with everything that's in there. Just like adopting any new training, you want to be sure that it meets the guidelines of your state. Some other resources, I'm going to let Diane talk more about these because she knows about these a lot more than I do.
Sure. The Penn State University has a very substantial program for early childhood child care called Better Kid Care. And there are online lessons, there are lessons that you can purchase from them and teach face-to-face. Teach face-to-face. And one of these is healthier plus healthy spaces equals healthy children. And so those may be resources that can help you as well. Child Care Aware is the national child care resource and referral advocacy group. Every state has child care resource and referral agencies that help child care providers get resources and generally help families find child care. So Child Care Aware also has a lot of resources on many topics, including this one. And then the E-Extension Alliance for Better Child Care is an E-Extension community of practice that I am a part of, and some of my colleagues in early childhood are a part of, that is teaching child care providers about a whole range of topics related to safe, healthy, appropriate child care, including some topics related to health and safety. We need some additional resources in this specific area of healthy environments, but there are some pieces to help you get started that you're welcome to distribute.
Okay, and I think if I remember, Missouri uses some of the pieces of the Better Kids Care training. So it may be that you end up pulling together pieces of information, but there is a lot of, borrowing is what we do really well in Extension and sharing. So as long as you give credit to whoever created that, most people will share anything that they've done. So you don't actually have to start from scratch. And one of the things that, as you look ahead and you think, well, the child care is really a great training opportunity for Extension to reach out, and especially on healthy environments. There isn't a lot out there on healthy environments, as Diane just said, so it's a great opportunity for us to say, hey, I have the knowledge about healthy environments, and my colleague over here knows a lot about working with child care providers and doing child care trainings, and if you're in Extension, you know a lot of Extension agents who do child care trainings on different subjects, just not on healthy environments. So it's a great opportunity. And one of the things that we've recently found, and Missouri had done for quite a while, was the emergency preparedness training. Georgia, we just kind of did that a few months ago to train the agents, but this is an area that really could blossom into something much bigger. We need to make sure that the facilities and the centers are trained so that if something happens, and an emergency may be a tornado, could be a hurricane, it could be a flood, it could be a person of danger. Here in Georgia, we just had escaped convicts, which puts everyone on alert. There's lots of issues that can happen, sadly, but some are acts of nature and some are other things that that you want to be sure that facility is trained and they know, where do I find what I need for that? How do I reunite parents and children after an event? Do I stay in place? Do I shelter in place, or do I leave? And knowing what leaving means, where do I go if I'm supposed to leave? Is there a place in town, and where is that? So this is now a requirement of the Child Care and Development Block Grant Act. It may be implemented in different ways in every state, so you need to check with your state to see what's going on. but that's a great training opportunity. When you teach something at a child care center, you also have the parents. You have not only the people who teach the students, so you've got child care providers, you've got parents, and then you have anyone who connects with that. So you're training the children, but you're training the facility. So there's a lot of audiences there. Parents being one of the more important ones, because we're talking about very young children, so you can't actually hand them a piece of paper and hope it will make it home to the parent. But you can provide parents with information and resources, especially like I said before, and asthma is a big area. Asthma education at that center as well as with the parents is critical, but you want to coordinate it and make sure you're reaching all the audiences. There may be other opportunities that I'm not aware of that you all may have know about, so please feel free to share that. The other thing I want to be sure and mention is our app and the new publication that was created as a partnership, extensionhealthyhomes.org, the national partnership, and then HUD. It is Everyone Deserves a Safe and Healthy Home. Now that again is focused on homes, so you want to adapt it. You don't want to just use it as is in your child care facility. You want to adapt it so that it relates more to the issues that are in that place. But you can send it home with parents. The app is great. I have used it, and I'm not an app fan, but I like this app, and it talks about health impacts, what you can do, and there's always that wonderful checklist that people love so much, to be able to walk through my home and see things that are wrong. So that's an app that would be very helpful. You can also, if you're still a book person, you can print it out and look at it online. And I think Michael said that down the road it will be printed out in a print version, because everyone's a little bit different, whether I want to read it on my iPad or I want to print it out and look at it. And that's okay. So kind of to bring it all together, we want to talk about those 8 principles, which are of a healthy home, but here they're of a healthy environment. It's all the same. It's keeping things clean, keeping things put away, keeping things safe, contaminant-free, dry, ventilated, maintained, pest-free. So you want to make sure that your environment is an environment that does not feed into any kind of a health issue. And more researchers and even some healthcare systems are recognizing that if I take a child who went into the hospital with asthma and I send them home into an environment, and then they go on to their child care facility and they still are exposed to those triggers for their asthma, I haven't done anything right. I need to make sure I recognize that the environment could be the cause or the trigger that makes their asthma worse or is causing those problems that they're being exposed to that lead. So it becomes really important that we understand it's a whole comprehensive thing. So when you look even in your office, you know how we used to talk about sick building symptoms and sick building syndrome. Everything we're exposed to indoors impacts our health, whatever age we're at. So to recognize that and translate that into a child care center and talk about what can we do to make that environment better, recognizing that children are more vulnerable than you and I are to everything. We want to make sure we give them a really good start, so we want their environment to be healthy. And as an educator, this is a great area to provide resources in. So I've got questions, and I actually ended early because I was afraid I'd go over, so man, I've given you half an hour. So if you have any questions, please let us know, and Michael will unmute you all.
I've unmuted everybody's mic, so hopefully everybody will be able to ask a question. You're also welcome to use the chat window if you have other questions. I do want to follow up with one of the things that Pam said, because I'm in direct contact with HUD. The Everyone Deserves a Safe and Healthy Home guides, there's one for consumers and there's one for stakeholders, and they are in the process of securing funds to print them. So sometime this summer, through the announcements through HUD and through the Healthy Homes Partnership, we will be announcing that they're ready to order the printed copies. In the meantime, if you download the online version, you are allowed to print as many copies as you want. Usually, of course, that would be just as good as your printer is, but if you want to print your own copies, there's no restriction against doing that. So if there's questions, please feel free to ask them. I want to remind everybody that this is going to be, this is recorded. So if you have colleagues that you think, I've got colleagues in the child care community that would be interested in this webinar, we will be posting it on the HUD.Healthy Homes website plus the National Healthy Homes Partnership website. So we're getting a question. It says, so when presenting this type of program to child care providers, can I use the 8 principles of healthy homes, environments, and CEUs for child care providers? Absolutely. If you use our curriculum, Pam mentioned the Healthy Homes Partnership Toolkit. That's actually for your own use. You don't have to pay a fee or anything. We welcome you using it. We just ask 2 things. One is a requirement and one is a request. We ask that you keep our logos on the material when you use it. So if you're using our PowerPoint slides, which again, you're more than welcome to use them, we do require that you keep the HUD Office of Lead Hazard Control and Healthy Homes and the HUD, the Healthy Homes Partnership logo and the USDA logo. If you look on this slide at the bottom, you'll see the first 4 logos to the left are the ones that are required. Then you are welcome to use your own logos on those slides. But we're actually funded by HUD, and that's one of the requirements that we keep the logos intact. And then as a request, when you're on the Healthy Homes Partnership website, there is a link that goes to what's called reporting. And we do appreciate if you use our curriculum and you go out and you do a webinar or you do a workshop and you have a certain number of people and you get feedback, to go ahead and record that on our website. It's not required. We just ask that you do so because we do keep track of how often the curriculum is used and to what types of consumers, homeowners, renters, children, elderly. That information is very helpful. So we do appreciate if you can give that information. So we now have another question.
Michael, can I add one more little thing about
Sure.
presenting to child care providers?
Sure.
I just wanted to add one more reminder. Lakeisha, I know you, and I'm glad to talk with you to make sure we're meeting Georgia requirements. For those of you in other states, don't forget that every state has specific requirements in terms of who is allowed to provide training that meets licensing requirements and what you have to do that. So be sure you check with your appropriate people. If you've got a human development specialist who works in child care, that's a great place to start an extension. If you don't, your child care resource and referral agencies or your state licensing agency can also help you out.
And Diane, that's a really good point, and let me add to your point. So in the state of Missouri, we actually have to go to the website for that education and declare ourselves as a provider for the continuing education, and I believe they even do a background check for us in Missouri, but I know I have to update that about every 1 to 2 years. So that is absolutely essential. I guess I was referring to if you're giving a workshop to another entity like a Rotary Club or something like that. Again, the only requirement on actually using our stuff is that you just maintain the logos and acknowledge where the original information came from. So we now have another question. It's understanding that child care facilities are smoke-free. Can you share any resources to support coalitions to engage child care providers in talking with parents about secondhand smoke exposure in the home? Diane, do you want to cover that first, or?
I don't have a whole lot of specific resources. I'm sure they are out there. Again, because child care programs are generally required to be smoke-free, those are not resources we have as much in the child care domain.
But there may be things in, I know HUD has done a lot of smoke-free in housing, so it might be that there's facilities or resources. I know here in Georgia, the Department of Public Health has a lot of resources. I don't know that there's actually groups or people working on it in particular, but the exposure at home would be a factor as well. So I would say the health departments in your state, and then HUD also does a huge amount in health in smoke-free. Extension in some states do. We don't do a lot here on smoke-free.
I do know that HUD has a guide on smoke-free public housing and a smoke-free home. The American Lung Association does also, and as Pam said earlier, obviously that's not the same as a child care facility, although some people have them in their home also. But I think it's good to promote all of those environments being smoke-free. It is difficult in talking with some clients how you approach that subject, and we highly encourage them to read up on the data, to read up on the consumer guides so they understand the effect that it does have on children. And if they are going to be a licensed care facilities in a state that may not have that restriction, it's important to also, again, understand the consequences of having that, have smokers inside of the facility. And again, just to connect the dots to all of the things we're talking about today, Pam talked about the importance of not parking your car next to the fresh air intake of a building and then having that circulate through the facility. So even to the point of there's recommendations on smoke-free environments to not have, if you do have a facility and people are allowed to smoke outside, we recommend that they stay way away from those fresh air intakes, because otherwise that's just circulating it back through the facility. And actually, it looks like we got a good link here from Pam. It's Breathe Easy Coalition in Maine, so that's probably the best resource.
And I'm not really familiar with that one, but I just did a quick Google when Michael was talking, and that came up. And so it's a coalition of people working towards child care facilities. So it could be a very good resource to start with, at least.
Are there any more questions or comments from anybody on the webinar? So someone said that's actually their organization. Well, Amanda, fantastic. So we just gave you a great plug for your, and actually, Amanda, if you'd like, we wouldn't mind if you have a chance after the webinar to go ahead and send me and Pam some of those links, and then what we'll do is we'll add those to our Healthy Homes Partnership website so that people can see those are available to use. So we appreciate that. Seeing as that there are no other questions, I'm going to go ahead and stop the recording. We again thank everybody for attending today's webinar and remind you that there will be another webinar next Monday at the same time, and we look forward to seeing you for the rest of National Healthy Homes Month.
Thank you very much, and remember you can always contact myself, Rebecca, or Diane for more information.